priorities of what a national PrEP program would need to look like in order to address the racial disparities, particularly among Black folks in PrEP access, use, adherence, etc., that we all know. Nearly since the beginning of the epidemic, Black people have been disproportionately impacted by HIV in this country and globally. If we have any sort of seriousness at all about, ending the HIV epidemic, as we've been sort of talking about the last decade, then Black people have to be at the, front of the line in terms of, access to treatment and to prevention. And PrEP is a, major prevention strategy.
Today, only 9% of Black people who could benefit from PrEP are using it.
We have absolutely every tool we need now to end HIV. PrEP is one of them. And when we think about the amazing medical advances of PrEP and how Black communities could benefit greatly from it, but we're not. You have to look at the reasons why. And everything is not about personal behavior and choice. Some of this is the infrastructure and the systemic issues that Black people have had with HIV from its very existence.
When we look at HIV and we see how we are disproportionately affected, we are only 13% of the US population, yet we consist of more than 50% of the new HIV diagnoses every year. Until we examine those things, HIV is always going to be prevalent within our communities, regardless of the level of access that we have.
Right, we're at the culmination of more than 450 years of systemic oppression. And that systemic oppression sits right at the juncture of sexual and reproductive health rights and justice. So when you talk about HIV and you lift up all of the societal ills that create vulnerability, and at the top of all these measures or indices of vulnerability sit Black people.
When you are part of a community that's either been over-sexualized or demonized because of your sexuality, having something that relieves that anxieties, having something that puts you in control of your sexual health is definitely something we all need access to.
PrEP is a really powerful tool that we have to combat HIV, and really, unless we're able to get PrEP to Black people, it will be impossible to end the HIV epidemic.
I'm grateful this summit was organized to find solutions to the problem of uptake in the Black community.
I think what stood out the most to me today was that people were hungry for this conversation. These are people who are advocates, they're peer navigators, they're PrEP users, they're PrEP navigators. They see what's happening.
And when you look at all those strategies, and I'm seeing that we're all coming at it from very different angles, I think that that's a beautiful thing, and I think that that's how we move forward.
I think what really worked well today with the PrEP in Black America Summit is we didn't just come together and brag about the work that each individual or each organization is doing. We didn't just come together to spread awareness. We actually came together to talk about the challenges and the systemic barriers we have to get in the Black community on PrEP.
There is something fundamentally missing with the way the systems of care, treatment, and prevention are set up. They are not set up to serve our people for a various number of reasons that we've described here today.
It really moved me because I've been in the work since 2012, right? Before 2012, but certainly since, PrEP was, first approved, the first drug approved for PrEP. And it never occurred to me that what we were doing today was the first time that this sort of thing had happened before.
Today's meeting was really so important because it was about figuring out the beginning of the roadmap that will allow us to ensure that we have equitable access to PrEP specifically for Black people.